This is Brent of the Brookbush Institute, and in this video we're going to go over manipulations or high velocity thrust techniques. I assume that if you're watching this video, you're watching it for educational purposes and that you are a licensed professional with high velocity thrust or manipulation techniques in your scope of practice. If you're not sure, check with your state board. Most physical therapists, chiropractors, and osteopaths, you're in the clear. I believe that ATCs, you can't do manipulations in the United States, although other countries. Again, check your scope. Of course, massage therapists and personal trainers, these are generally not within your scope. Of course, you could continue to watch these videos just for educational purposes, learn a little anatomy, learn a little biomechanics. If you're going to do these techniques, please make sure that you have a good rationale for putting your hands on a patient. This should be based on assessment, and if you're going to assess, I'm hoping that you'll assess, use these interventions, and reassess to ensure that you're getting the result that you're looking for and have good reason to continue using this technique. In this video, we're going to go over carpal manipulation. I'm going to have my friend Yvette come out. She's going to help me demonstrate. Now keep in mind, if we're doing manipulations, they're always based on subjective and objective measures. In this case, maybe we would be looking at pronation, supination, flexion and extension of the wrist. Right? We could try some goniometry for flexion and extension of the wrist. It's questionably reliable. Now I think you guys are going to find this technique is actually super simple and kind of fun. So go ahead, let's do your left wrist. There we go. So what you guys are going to do is you're going to palpate to the end of the radius and ulna. Now at the end of the radius and ulna, you guys know you have a proximal and distal row of carpal bones. Now we could go through all of these different bones and all that fun stuff. But we actually don't have to for this technique. Really all you need to do is guys can do like posterior, anterior kind of glides to check passive accessory motion. You could even kind of keep your hands, thumbs on the rows and kind of test flexion and extension and see if any of the bones feel stuck to you. Right? You can kind of just move over in a real segmental fashion. Remember, these bones are pretty small, so as you're moving through, good, okay. Well, now you found something that you think is stiff. Once you find something that you think is kind of stiff, maybe I think right there is stiff. Right? What we're going to do is we got to lock out this joint. So how are we going to lock out this joint? We're going to pull a little bit into traction. I'm going to pull to the end of extension. Now, as I'm pulling to the end of extension, what I'm doing is I'm actually applying what are we going to call this? A volar to palmar. There you go, look those words up. All right, force, right? So we're going from the back of the hand to the front of the hand, force this way. So I'm pushing down with my thumb as I pull into extension. Once I have her at the lockout, I'm now going to do that ever so fun whip. Right? So we get her here and boom, we got a nice little cavitation. Right? And then if I wanted to, I can move over. Right there. And boom, we got another one. And then I can move over again. And we got another one. Isn't that great? Now, the thing that people forget is you don't have to just go into extension. If I feel like there's stiffness into flexion, I can now go opposite. This gets a little tricky. I tend to use like this knuckle right here to kind of palpate the bones from underneath, and then once I get good purchase, I'm just going to go a whip into flexion. Right? You okay? Mm-hmm. Am I pinching? I'll try not to pinch. All right, so it's probably better, guys, as I'm taking my thumbs here, the mistake I made on the first one is I had my thumbs a little too high, so I was pushing into a lot of soft tissue, pushing that soft tissue into these tiny little bones. If I cross my thumbs over her metacarpals, it's a little less pinchy. I'll try to get a little lower here too. Ready? Mm-hmm. And that's it. Ready? So there you guys have it. These manipulations are super simple. I'll go ahead and do a close-up recap for you guys so you can see how my thumbs are moving across. But essentially, again, you're going this way when you're going to extension, and it's a whip. And you're going to push this way and pull into a flexion when you do a whip this way. Stay tuned for your close-up recap. So I just wanted to show you guys a little closer on what I'm palpating. So if I come to the end of my radius and ulna, I'll feel my little carpal bones, which feel like little pebbles, right? And as I move them from dorsal to volar, my mistake in the previous video for saying volar and palmar as opposites, those are synonyms. So dorsal to palmar or volar, I can kind of see if there's stiffness, and I feel a little bit of stiffness right here. Now once I feel stiffness, I'm just going to go kind of thumb over thumb. I'm going to pull to end range extension, right? So you guys can see here, this is what I'm doing with my other fingers, right? And then once I get to end range, I just give it a little whip. That's it, right? Real easy. I can move to the next segment over, right? So if I was here, which might be our handmate, and then I can move over here, and I can pull all the way down and do it again, all right? If I wanted to go more medial, I could do that, right? Thumb over thumb. And if I want to go into flexion, work on maybe flexion range of motion, I could do that. I could then go from palmar to dorsal, right? See if I feel any stiffness that way. Now this time I'm going to use more like this part of my fingers here to kind of push up this way. All right, so without getting too mean to Yvette's hand here, I'm just pushing up this way, guys. Right, kind of using my knuckle as my fulcrum. Right, and then I can pull all the way into flexion. Right, and then just a little whip. All right, so there you guys have it. Give those a little experimentation with friends and colleagues first, and then of course you can try them with patients. If you have any questions, leave them in the comments box below. A couple of points to recap. Knowing your anatomy and knowing your biomechanics will certainly help you choose the right technique for the right patient. If you're unsure whether manipulations are appropriate due to their higher intensity, it's okay to do mobilizations. Most research points to manipulations being slightly more effective, but mobilizations being very effective. And of course, we have those videos for you if you want to start with those less intense techniques. Make sure that if you are doing any technique that is based on assessment, and of course that you're reassessing, ensuring that the technique is effective for the patient that you're working on. And when it comes to all manual techniques, guys, manipulations, maybe more than any other, look for opportunities to get live education. Although I know videos are convenient and I'm happy to have these up for you guys to watch, it would be so much more helpful to use those videos as a recap of one-on-one attention with somebody who's experienced with manipulation techniques. At the very least, grab a colleague, grab a friend, and start practicing these before you bring them into clinic and start using them on patients and clients. I hope you enjoyed this video. If you have any questions, please leave them in the comments box below.